an ultrasound approach. If you've got difficult access or potentially the need to go for a very deep vascular access.
We're going to use a deep access today. So we'll be using this flat probe, but as the ultrasound waves come out like this, you want a good space to be able to use it to your advantage. You're going to be using ultrasound jelly across the top. At the moment, we don't need necessarily to have gloves on, we don't need to be sterile, we're just looking. I tap one end of the screen, and as you can see, I'm tapping the left and it's coming up on the right. So actually, I need to swap my probe round. So now that right is right. Opening up the arm as we can. We know the ACF, we know our anatomy, we know that the vessels are going to come all the way up here towards the neck. We're going to start off by just putting it on the side. So we see right at the tippy top in the middle a nice round lumen. You've actually got two lumens there. So it's quite small at the moment, so we're going to need to reduce the depth. So now we're a little bit closer, okay? On the left-hand side of the screen, you can see the markings and you can see where 1 centimetre is. So in the back of your mind, you know how far in we need to go. Compressibility is one of the things we use. So I've compressed this quite hard and it's pulsating. So that is arterial. More medially, so coming around the arm, is a massive, very compressible vessel right in the middle there. It's quite about 1 centimetre large. You see right nearby, when I compress it completely, there are 2 smaller lumens. Those are arteries, so we have to be a little bit careful sometimes. Underneath, you see there's quite a large amount of bright white. So arteries, veins and nerves travel all together. That bright white bundle you see underneath it is probably a nerve bundle. If I puncture through and through that vessel and I go into the nerve bundle, that will be quite painful. If you think that you can find a nice vessel but it's under a lot of muscle, that also might be quite painful. We want to just go through a bit of subcutaneous fat, hopefully, and maybe a little fascia, but we don't want to be digging around through lots of muscle. We're going to make sure that left is left and right is right. When we pop this on now, we're going to make sure we go from far away to close, because what we don't want to do, even if it's sterile, is get lots of jelly in our space that we're going to put a cannula in. We can see our nice large vessel in the middle once again, remembering that there was a valve here which we want to avoid. And confirm it's nice and compressible. And I've not put jelly in my clean, sterile area. We're going to make sure the vessel is in the middle of the screen. One-handed holding the cannula. 45-degree angle, about 1 centimetre away from where we're thinking we're going to go into the vessel. A sharp white line. So that's our tip of our cannula, because as I'm going away from it, I can't see it. As I'm coming towards, I can see it again. And you want to come up a couple of centimetres to make sure we're still in. I can put the ultrasound down. I can grab the cannula with my left hand. We can withdraw it a little bit, push the whole thing to the vessel. Removing, putting your finger on top, and it's deep, so you're going to have to push really hard to make sure this blood doesn't come out. Popping your sharp away, twisting that on. We could, if we wanted to, withdraw back, and you can see. I'm going to make sure I wipe all of this ultrasound jelly. The sticker is not going to stick. Now you can relax.
I'm actually surprised how unpainful that was in the grand scheme of things, given I'm someone who doesn't have a massively high pain threshold.